Cultural competence in healthcare, why it matters. Cultural variations exist in several areas pertinent to the healthcare provider. Communication, childbirth, nutritional preferences, and beliefs about sexuality, death, and dying are not the same for all people. Healthcare workers should be culturally competent in order to provide the best possible care to our patients. Sensitivity to the cultural beliefs and practices of others increases patient satisfaction.
I want to provide high-quality care that incorporates culture, but I'm not sure how to begin.
I hope I'm meeting the needs of my patients and their families. The patient population is becoming so much more diverse nowadays.
Social justice demands cultural competence. Without culturally congruent care, disparities in health and healthcare will continue to exist. Cultural competence is a right, not a privilege. Therefore, culturally congruent care is not special. It's an expectation. It's part of quality and safety for every patient.
I agree. Good enough just isn't good enough. Healthcare professionals should strive for developing optimal cultural care. Everyone deserves the best. Would you accept a minimum standard of care for yourself or for a loved one?
Cultural variations may exist in accepting treatment, making the choice to donate organs, or discussing illness. Let's look at a case.
My name is Cecilia and I am your respiratory therapist. Your oxygen level seems to be a little bit low because of your pneumonia. So I'm going to put this oxygen on you. If that is okay. Right there.
Hello, sister. Is she getting worse? Why are you putting the mask on her face?
Her oxygen level was a little bit low because of her pneumonia. I am going to recheck her oxygen now to make sure it's okay. It seems to be improving, and I will be back to check in on her. The doctor should be back in shortly.
In this case, oxygen may signify to the patient and family that the patient's condition is worsening. It's important to communicate well with the patient and family regarding the use of medical devices and medications. Healthcare providers should familiarize themselves with various types of treatments that fall outside the scope of traditional Western medicine. Some patients may choose to pursue alternatives such as cupping, acupuncture, and coining. Information about various cultures serves as a broad guideline, so be careful not to stereotype. Remember that in some cultures, a family member or members may make decisions for the patient. Be mindful of alternative medicine and traditional techniques that fall outside the Western medicine arena, as discussed earlier. It is important to communicate with the patient to determine their wishes for their care. Respect their values, their religious and cultural beliefs. Learning about the diverse patient populations you serve is an important step in becoming culturally competent. An effective educational or training program for cultural competence correlates with lasting awareness and understanding by hospital staff. Although there are several approaches to educate staff, a successful educational program includes cultural assessment, multiple training methods, ongoing education, and measurement and tracking. Thank you.